Hello and welcome to the Connected Community Podcast. I'm so excited to introduce my guest today, Andrea Schwieger. She is a certified registered nurse anesthesiologist, and she was in intensive care for many years, and then she became board certified to lead surgical teams in safe anesthesiology practices. Through her own path, she moved from physical health and anesthesiology into ketamine-assisted therapy. She is in Denver, Colorado. She has her own IV infusion ketamine clinic. And today we talk about everything ketamine. I went recently and had an intermuscular ketamine experience. I did this in a really safe setting in a therapeutic session. And as a therapist, I wanted to know what that was like. And the experience was wild. So we talk about ketamine, everything about ketamine, the different formats, how to do it safely, how to do it effectively, what the arc of that experience looks like, who it benefits, and so much more. So I hope you enjoy this podcast. I want to thank you so much for being here. And I'm going to hop on in with my episode with Andrea. Enjoy. Hello, and welcome to the Connected Community Podcast, a place to explore possibility through mindfulness, movement, and self-discovery. Our intention is to deliver insight and inspiration while fostering conversations that are genuine, unfiltered, and deeply human. We hope you will enjoy today's episode. Hey, Andrea, welcome to the Connected Community Podcast. I'm so happy to have you with me today.
Yeah, thank you, Nikki. Thanks for having me. Excited to be here and talk about all things ketamine.
Yes. So we're going to talk about ketamine-assisted therapy, and you're a nurse and anesthetist.
Yes.
And ketamine is an anesthetic. And so
hmm
today we're going to talk about ketamine therapy, and there's so many different ways to administer ketamine, but
Yep.
you own a IV clinic. Is that correct?
Correct. Yes,
Yes.
I do.
And so we're going to talk about all the different forms, but with the framework of your expertise with IV mostly. But I'm really
Yep.
curious about what led you to leave the world of anesthesiology and moving in towards ketamine, which is similar, but it's mental health versus dealing with like physical health issues.
Yeah. Yeah. Great question. I get that a lot. So, you know, when you think about anesthesia is really actually just a manipulation of consciousness. That's what we're doing in the operating room. We're changing your level of consciousness for this in that context. We're changing it maybe for a surgery or a procedure to make it more tolerable for you and reduce pain, things like that. And so it's kind of like taking that skill set and just like shifting it just a little bit to the mental health world where, when we think about psychedelics for mental health, we think about accessing different levels of consciousness, things that we can't access when we're awake, alert, and oriented in this 3D space. And
Mm.
so it's kind of just like taking that skill set and just like shifting it just a little bit. And an easy entry point for me was ketamine. I already use it in the operating room. It's a fantastic anesthetic. We use it for kids, adults, even for pets. That's not what I do, but we use it for pets for anesthesia too. And so as I've done continuing education in the anesthesia world, I started learning about new applications for ketamine in the mental health space. And so that kind of helped with my transition of like, oh, interesting. I'm already kind of doing this in the operating room. Like I'm manipulating people's consciousness for surgical purposes. Now I can use that skill set in maybe a more interesting, meaningful, impactful way in the mental health space just by using that same medication in a slightly different application. So it just kind of started with an interest actually in consciousness that led me to anesthesia. And then some continuing education that showed me some new opportunities to use the same skill set.
Yeah. Yeah. And ketamine is legal. We're in
Mhm.
Colorado. Tell us about the legal standpoint with ketamine. And crazy enough, I was looking on Facebook last night, and this kind of shocked me. They're doing this thing where you can go through a company and order microdoses that get shipped to your house. And
Mhm.
so that surprised me for one, because I think the effectiveness of
Yep.
microdoses is really confusing to me with the ketamine world,
Yeah.
but also that they're shipping it to people's homes. So
Yep.
can you talk a little bit about the legality of it?
Yeah, yeah, absolutely. So, legality wise, the quick answer is it's legal everywhere in the US. So, ketamine has been on the market and FDA approved as an anesthetic since the 1970s. So, we've been using it safely in the operating room since then. So, now what we've shifted to in a lot of circumstances of ketamine is using ketamine, what we call as an off label use for mental health. So, it's FDA approved for anesthesia, but we also know that it works for mental health purposes. So this is now considered an off-label use of ketamine for mental health. There's some caveats to that, like S-ketamine, specific formulations that are specifically approved for mental health purposes, but most people are still using traditional ketamine that's approved for anesthesia and an off-label use. So totally legal in all 50 states. Yeah, and there's just, as far as like the different routes of administration and being able to order ketamine online and getting it shipped to your house, this is still kind of like in its infancy. We're still learning a lot about ketamine and psychedelics in the mental health space, even though we've been studying it for years and years and years. We're still learning a lot about the application of that to the general public, to mental health patients. So that means sometimes there's a lot of wide varying interpretation of how it should be administered, the best ways it should be administered. So yeah, there's home ketamine use and all the way to the other spectrum of like probably what I do, which is pretty medically managed IV ketamine administration in a specific IV ketamine clinic. So you can either get it shipped to your house or you can come to us, and a whole
Mhm.
lot of different options in between. But yeah, there's a lot going on out there in the ketamine world for sure.
Yeah. Could you talk a little bit about the science and what ketamine is actually doing to the brain and how it works on the brain and the body compared to talk therapy or antidepressant medications?
Yeah, yeah, for sure. So probably like the easiest compare and contrast is with a lot of mental health medications. So when I think about how medications, and we'll call ketamine a medication in this instance as well, work in the body, we think about like different pathways. So your body is full of different messengers, different chemical messengers in your bloodstream that tell your body to do specific things. So when we think about mental health medications, traditional mental health medications, now there's a wide variety of them, but I think when we think about a lot of them, we think about serotonin. That is a chemical messenger that's in your body that we believe is related to mood and mood enhancement. So a lot of mental health medications focus on the serotonin pathway, meaning you take the medication, your body breaks it down into something it can use, and then ultimately turns on some systems in your body that either help you produce more serotonin, keep more serotonin in your bloodstream, help you keep you from breaking serotonin down, just so there's more serotonin in your body one way or another. When we think about ketamine, and there's a lot of other different mental health medications, but the bulk of them often relate to serotonin.
Mhm, yeah.
So when we think about ketamine, we're actually looking at a totally different pathway. So we're looking at the glutamate pathway. So glutamate is another chemical messenger in your body that tells your body and brain to do different things. And so when we think about ketamine, ketamine actually initiates that glutamate pathway. So that what's really important about that when we think about mental health is that the end point of ketamine is specifically in the emotion center in your brain. And what ketamine does is actually help to create new synapses or new brain connections. In that emotion center in your brain. So that's an opportunity for new outlooks on life. That's an opportunity for new patterns. It's an opportunity to heal old patterns that maybe aren't serving you. So it just kind of like creates this new opportunity for mood enhancement. And then what you do with that is kind of up to you as the patient or the client, but it creates those new synapses to help help get you out of some of those old patterns that may be creating anxiety and depression.
Hmm.
So really when I'm comparing like traditional mental health medications versus ketamine, I'm thinking about like the chemical messengers and where they work in the body and how they work in the body. So it's just kind of like a new way to look at mental health and mood disorders.
Yeah. So when you say that, it means that ketamine is also safe for people that are on SSRI antidepressants, which a
Mhm.
lot of the psychedelic medications aren't safe with people on SSRIs. Is that right?
Yeah, yeah. So that's what's really cool about ketamine is because it's been on the market for so long, because it's actually kind of had a different entry point into legalization, which is through the FDA. Meaning they've had a ton of trials to make sure it's really safe for all sorts of people. We know that it's safe for people who are taking SSRIs or other types of mental health medications. So I always tell people like, hey, it plays really nicely with most medications. So there's
Hmm.
very few medications that I have to worry about or work around when people come in and they're taking a variety of mental health medications. It's super safe. So that's what's so cool about ketamine, and kind of to your point, like sets it apart from other psychedelics. And in the future, we may find that other psychedelics are okay with mental health medications. We kind of just don't know yet. There's like not enough research for us to be able to say, hey, yeah, that's super safe. But because ketamine has this history in the medical field already, like we've got all that information. So that makes it super safe for people who are coming in with mental health medications already.
Yeah. So with most other psychedelics, you talk about like setting, intention, things
Hmm.
like that, integration. With
Yeah.
ketamine, because of the way it works on the brain, is there an importance to the integration piece, or is the ketamine the thing that's changing the brain that's doing its work, and that integration and that intention aren't as important?
Yeah. Um, yeah, it's kind of like a little bit of both, but I would say more heavily focused on like the integration, preparation, integration. So the reason I say it's both is because oftentimes when I see people coming in for ketamine, we have people come in for a series of infusions. That's kind of like
Mhm.
standard practice, I would say, and kind of like gold standard of research that we know about ketamine. So um, what I often see is when people come in for like their first infusion or first couple infusions, they do get like an initial boost in mood. But what really makes the results of ketamine long lasting is that preparation and integration piece. Because ultimately, I feel like with all psychedelics, they sort of like show you the endpoint, but they don't
Mhm.
give you the skill, right? So maybe in your ketamine session, perhaps like you come out, maybe you came in feeling really depressed. You come out of your session saying like, oh my gosh, I can feel joy again. I
Mhm.
know I can. I just experienced that in my ketamine session. Well, that showed you what you can do, but it didn't give you the skill to get there. So that's what preparation and integration do during that ketamine time frame. It's like, okay, now you've got a goal. Now you see like maybe how you can feel or something you want to do, or a change you want to make in your life. Like now, how do we bring that back to this 3D world that we live in, this earthly world, and teach you the skills to get you to that endpoint. So you can get that initial mood boost with
Yeah.
ketamine. We do see that. That's not uncommon, but to really get that to last, to really get long lasting results, preparation and integration are just so important.
Yeah. Yeah. All right, so you and I were talking briefly beforehand, and I was telling you I did my first ketamine session. My friend works at a ketamine clinic, and because
Hmm.
I'm a licensed therapist, I wanted to see what it would like to be in a clinic, in a therapeutic
Hmm.
setting, to be safely administered, to get the correct dose. It was IM, it
Yeah.
was intermuscular versus
Yep.
IV, and there were four of us in the room because it was a friends and family thing versus like a one-on-one. And
Yeah.
what I found was that when we were talking about our sessions afterwards, four of us had pretty different experiences, but there were not words that could really come to explain our experiences. So two of the people had kind of an apocalyptic experience where they
Yeah.
saw the apocalypse and the end of the world and things like that, and hospitals tumbling down. And one of the girls felt like she was getting swallowed up by earth. It didn't create fear. They were just kind of like, huh. My experience was really
Mhm.
different. And so we were talking about like the integration piece, and I don't really know how to integrate my experience. Even the girl that took me works for the ketamine clinic. She's a therapist there.
Mhm.
And she was saying, I don't know how I'm going to integrate this experience. And I'm sure you hear that a lot. So what happens? Because the
Yeah.
ketamine's weird.
Yeah. Yes.
It's super weird, and it's not like anything else. And so
Yeah.
I was having trouble even putting words to it because it was so bizarre and so out there. It was very pleasant. It was very
Mhm.
enjoyable. There were moments for me where I felt a little bit of anxiety and a little bit like I wasn't, my mantra during my whole session was like, surrender, breathe, and trust, surrender, breathe, and trust.
Yeah.
And so anytime I had trouble breathing, I was like, okay, I'm going to breathe into this, or something came and it was
Yeah.
not what I expected. I would just like settle in and breathe, and that helped. So I could see how it would create a little bit of anxiety, or can.
Mhm.
But I'm wondering, in those situations, when people come and they don't even know what to integrate, then
Yeah.
are we getting enough of the benefit of the session? And I realized that it was a one off. We
Mhm.
did a one session instead of a series of six, and we didn't get the whole psych eval and the whole integration groups and things like that. So we're not getting a
Sure.
full experience, but I got a taste of it. And so what
Yeah.
happens if you can't explain what happens?
Yeah. Um, I hear this a lot. So I'm glad you got to try it because I think also too, as like a mental health provider, to be able to have that experience, even just to speak to your clients like that, to be able to speak to that medicine, to your clients, I think is just so helpful. Um, so cool that you got a chance to do that. So what I find with people is almost a similar process with everyone who comes out of an infusion, especially if they're new to ketamine. So, say they're new to psychedelics, even in general, they're here for their first infusion. After we go through the process and they have their infusion and they start to wake up, usually, we give people some space and then come over and start to talk to people a little bit. And the first thing I always say was, well, how was it? And almost across the board, the first thing people say is, I don't know. And I'm like,
Yeah,
okay,
it's
okay, no
super weird.
problem. Totally, totally. Because we've got, our language is built for this earthly world. You're in a totally different space where our language just can't capture that. And so, then we start to work on things like in that initial time frame right after the ketamine, when it's still new, still fresh, still raw. I'll start to ask people questions like, okay, well, how did your body feel during the experience? Because usually
Mhm.
that's something that people can, something physical, it's easier for people to talk about that sort of thing. So I'll
Mhm.
often hear people say like, oh gosh, I felt like I was floating. And I'm like, okay, did it feel like maybe you were in space or in the ocean? Like, yeah, I felt like I was in the ocean. Okay. Okay, were you numb and tingly? Yeah, I was numb and tingly,
Mhm.
and then we'll say like, okay, well, did you see any shapes or colors? Did you have any visualizations? Well, I'm
Mhm.
not sure. Okay. Well, did you see shapes and colors? I'm like, oh yeah, you're right. No, I saw the color yellow and I saw some triangles and I saw actually it looked like a kaleidoscope. And so it's sort of like, my goal for people is to not necessarily put words in their mouth afterwards, but
Mhm.
actually just to get the wheels spinning because it is a totally new experience and we
Mhm.
kind of don't have the vocabulary for it. But once we can get people kind of maybe more in tune with their body, where they can start to think about, like, okay, what did my body feel like? They can start to record some of those sensations and then they can kind of start to think about visualizations like, okay, yeah, I did see some colors. Okay, let's write that down.
Mhm.
So what I encourage people to do is just anything that they can put words to, write it down. And sometimes
Mhm.
it's just one word at first. And then later, after they sit with the experience, sometimes a little more information starts to come or they recall something else. So it's kind of, yeah, it's totally hard to put words to. It really is. But if we start prompting people, I find that gets the wheels turning. Another thing that I recommend with people too, after their experience, is just a free write. Just like set a timer. maybe for like 10 minutes, have a piece of paper, and write anything that comes to mind. Grammar doesn't matter, spelling doesn't matter. It could be words, it could be phrases, it could be anything.
Mhm.
And it really is sometimes once that ball gets rolling, you realize that you had a really full and vibrant experience and you can put some words to it. And we just know that I always tell people, like, hey, do the best you can. Words will never do this justice,
Mhm.
but do the best you can, because the more you can recall, the more you can write this stuff down, the more you can start finding patterns or parallels either in your life or perhaps in other infusions. So it's just that's our perpetual challenge, is like, how do we bring that 5D experience, that psychedelic experience back into this world? But those are some of the cues that I usually give for
Yeah.
people, as they're coming out of their experience.
Do they typically have such bizarre experiences that they have trouble putting words to it, or do some people have a very complete story that they can tell around it?
Yeah, some people do. So, and I would say that transitions over time. So I typically see people for a series of 6 infusions over about 2 to 4 weeks. So for the first infusion, afterwards I hear a lot of like, I don't know what just happened. And we're like, that's okay. We'll sit with this. We're gonna, like,
Mhm.
you may never know totally what happened. That's okay, but we'll, try and identify the things that we can identify and piece together a story for
Mhm.
you. And then by that 6th infusion, it's kind of like, people come out and we give people a notebook to journal in if they want to. And oftentimes I'll see people, like, after their 6th infusion, like, they're starting to come out, they're used to the experience of the medicine, and they may sit and just listen to music, and, they'll give me a wave, say I'm okay, or give me a thumbs up. And then they pick up their notebook, they listen to music, and they just journal away. And so
Mhm.
I feel like with more experience, you
Yeah.
come to understand the medicine more, and maybe even, I don't know, maybe you even, like, expect fewer earthly things from the experience,
Yeah.
where you're like, oh, that's just ketamine,
Yeah.
like, I hear people saying, like, oh yeah, I was on maybe someone might say, like, oh yeah, I was on a river of emotion riding a roller coaster through a forest. And after a first infusion, someone would be like, I can't even
Mhm.
describe that, and after their 6th infusion, they're like, oh yeah, I've been there before. So it just becomes, with experience, people just tend to understand the medicine better and be able to put the puzzle pieces together in a way that's meaningful for them.
Yeah. Yeah. So let's talk about, first of all, who would benefit from ketamine? Why would they come? We've already said like
Yeah.
6 sessions in 2 to 4 weeks is ideal, at least with the IV therapy. And then I would love for you to share what that arc looks like from beginning to end. So somebody's never been, they're considering it, they're wanting to know why would they come, what are the benefits, and
hmm
what does that session look like, at least the first session?
Yeah, yeah, excellent. So, as far as candidates for ketamine, I find the best candidates or the people who do the best with ketamine are people who are, first of all, like, really dedicated to a healing process, because it's actually hard work. There's coming in and sitting in the chair, and then there's the integration process that comes after that. So this is intense and it can be hard work. So people who are really dedicated to their healing process and open to exploring their consciousness and psyche. Um, the most common diagnosis that I see at the clinic, I would say, is depression, followed closely by anxiety and PTSD. And that kind of aligns with a lot of the data too. Those subgroups of people, depression, anxiety, PTSD, those are the most common diagnoses. That's where we see the most data and research saying, like, hey, ketamine can be helpful.
Mhm.
And I see that at the clinic as well. So those diagnoses are things that we kind of look for. Ketamine is not good for people who have had a history of, like, psychiatric breaks or schizophrenia, or
Bipolar
are
too.
actively, yeah,
Yeah.
exactly, actively in mania, things like that. Maybe we would consider that, like, a heightened brain state, if we were just kind of like giving that a global term. So we're going to put you in a heightened brain state with ketamine. And for most people, that's safe. But for people who maybe are already in that heightened brain state, ketamine would not be good for those
Mhm.
types of clients.
What about high blood pressure?
High blood pressure. Yeah. So that's something we consider on a case by case situation, because what we know about ketamine just chemically is that ketamine is likely to increase your blood pressure and your heart rate.
Mhm.
So people who have a sick heart might not be good candidates for ketamine. And that would include like high blood pressure. So
Yeah.
if it's high blood pressure and it's managed really well with some medications, that's something we
Mhm.
can usually work around. But if it's uncontrolled high blood pressure, and especially if you're having any other cardiac symptoms like
Mhm.
chest pain at rest or with activity, things like that, then ketamine wouldn't be a good choice.
Yeah, I felt my heart beat. I wish they would have told me that was going to happen, because that was the one
Mm,
thing I was like, "Oh, is that supposed to happen?" And I felt my heart pounding,
yeah.
and I was like, "Okay, breathe, breathe." But it was funny. Later, I looked at my Apple Watch. It was like I'd worked out for 6 minutes.
Yeah. Yeah. Yeah, exactly. And it's interesting. Like we monitor, at our clinic, we monitor heart rates, oxygen saturations, throughout the ketamine experience. So we're constantly watching your vital signs. And sometimes we'll see that heart rate go peak up, and then sometimes on its own it just comes right back down.
Hmm.
Sometimes when people come out of their experience, they may say like, "Wow, I had a really intense." Period during my ketamine infusion. And I'm like, oh, I wonder if that's, what
Yeah.
that heart rate was. And sometimes people come out and their heart rate may have been up and down and up and down and up and down. And they're like, that was great. So, so it just kind of depends, but we definitely see that heart rate change, definitely see that blood
Hmm.
pressure change. We keep track of that for sure.
Hmm.
Yeah.
All right. So what does that look like? Somebody's coming into your clinic. They come
Hmm.
in. It's 1-to-1.
Yeah, typically one to one, or sometimes, once we get people into their ketamine experience, you'll have your own space. We call it a nook.
Hmm.
You have your own nook where you've got a recliner, pillows, blankets, things to be cozy. We always recommend people wear an eye mask and noise canceling headphones with music. We help guide people on the music, but it helps to keep the experience sort of like contained.
Hmm.
It helps to keep it introspective and self-reflective. And so when people are kind of in that cocoon, in that nook, most of the time, what I find is people are kicked back in the recliner, they're listening to music, and they barely move during the session. They may like reposition a little bit, but most people are kicked back pretty comfortable during
Yeah.
the session and aren't really talking or interacting with us. So oftentimes, once one person is settled into their experience,
Hmm.
we'll get another person going in their
Hmm.
area. So sometimes we're one to one and sometimes we're one to two, just kind of depending on the clinic space. But what I find is
Yeah.
most people are just like in their space and cozy.
I mean, if the roof fell in and the fire alarms were going off during my ketamine experience, I probably wouldn't have noticed.
Yeah, exactly. Exactly.
I was like, I would have been like blissed out, like, it's all good. I think I could
Yeah,
move my fingers, and that
yeah,
was it. And I remember at one
yeah,
point my music went off, and there were four of us in the room. So I was trying to
yeah.
be respectful, but my music all of a sudden after like the third song went off, and all I could say was, my music stopped. And then she came over and she turned it back on, and I said, "Thank
Yeah,
you." And I was like
yeah.
really even surprised I could get that out.
Yeah, yeah, totally, totally. And I'll bet I hear the most questions about music. People will say to me while they're in their session, they're like, I love this song,
Oh, the
and
music
so I'll
was
write down the song for them.
super
So
important.
impactful. Yeah,
Yeah, I was
yeah,
really glad I picked the right music. They had some
yeah.
playlists in there, and I was like, I don't know, if a song comes on and agitates me, I'm not gonna be able to move. And I had my own playlist, and it was perfect, and I could see
Good.
how it could negatively impact the experience too.
Oh yeah. Yeah, for sure. It definitely can. We always recommend, there are certain playlists that we use, and we always recommend if people want to choose their own playlist, that the playlist is at least 2 hours long, just for what we're doing at the clinic, that it doesn't contain any words in a
Hmm.
language that you speak,
Yes.
and it's not something you're super familiar with, and it's something that's maybe gentle and flowing. Think kind of like meditation, yoga,
Yeah.
relaxation type music. Um, And typically when people kind of like stick to those guidelines, they do really well. Every once in a while, people want to try their own thing. And usually if it's got words or something in it, they come out and they're like, you were right. I shouldn't have had words. I was so focused on the words that I couldn't get into the experience. So it's
Mhm.
amazing the journey that the music will take you on.
Well, even my friend that works at the clinic said sometimes her favorite playlist when she listens to it, and she's only done it twice, but when she
Yeah.
listened to it, she's like, "Oh, I don't like that at all."
Yeah. Yeah. And it's so important too because one thing that's I think really interesting about music too, just even going back to when we were talking about like how do you describe the experience? How do you bring that experience back to this earthly world? I actually recommend that people listen to the playlist that they listen to during their ketamine experience sober. So like give it a day, listen to that same playlist and see if there's anything else that comes up for you, or if you remember a song or how you felt.
Mm.
Or sometimes it's really interesting too, where people will be like, wow, I really loved this song while I was on ketamine. And then I listened to it and I'm like, I can't believe I like that song because when I listened to it sober, it sounded totally different. So
Yeah.
it's just amazing, like the impact that music can have. Yeah.
Yeah. Yeah. My friend had warned me to, when you're in that ketamine experience, she's like, you might be able to wiggle your finger and your toes. I don't
Hmm.
think I would have had the ability to move. I guess if I tried hard enough, I would have been able to wiggle in my chair. There was no getting up. Even if I think I was able to grab my phone and get the music on, I couldn't move my hand. So I got the words
Yeah.
out and she came over, but I don't think I would have been able to navigate that on my own. But there is this sense of safety, like it's safe and it's comfortable. And
Yeah.
even my friends that were having the apocalyptic experience, and my one felt like she was being absorbed by the earth and sand and just kind of like sinking into the earth. It wasn't frightening for them. It was like, oh yeah, it's the end of the world.
Yeah. 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 Even if you're having like an end of the world experience, sometimes you're there like merely as an observer, which kind of takes you out of the action and emotion of it.
Hmm. When somebody, like, we were in our experience 55 minutes, I think, was when she kind of told us to come out of it. And what I noticed, I'm curious if it's different with IV, because we all had this experience. They put a shot in our arm, and within 3 minutes, we were gone, and it was like 0 to 100. And I think we pretty much flatlined at that state until the very end. And then coming out of it was really slow and really groggy. And then when we came
Hmm.
out of it, almost felt like I had Novocaine in my mouth. Like
Hmm.
talking was difficult, moving was difficult, walking took some time and some thought. And so we were there for 2 hours was when they kind of capped our session. And we had to have a driver. So
Yep.
I was like, I think that's overkill. And then when I was there, I was like, that's definitely smart. Make sure you
Yeah.
have a driver. It's imperative.
Yeah.
I don't think I could have driven. We went out and ate afterwards, and it wasn't until we had eaten and kind of gotten grounded, and it was probably an hour after we left the clinic or more that we were kind of back in our bodies. But
Hmm.
they said to us, don't watch news or anything like that that's going to stimulate you
Hmm.
too much, and don't get into any conflict, and that you'll notice that you have no filter. And I noticed that when we were at lunch, there was no filter, which I thought was really interesting. But it took a while
Yeah.
to like come back into my body. It felt like my body was drunk, but I wasn't.
Yeah. Yeah, totally. I think you're kind of hitting the nail on the head with some of that because, in the anesthesia world, we call ketamine a dissociative anesthetic, meaning we're kind of dissociating, we're separating mind and body, just the way it works in the body. And so we still get that dissociative feeling, even with mental health. Ketamine for mental health. So we're still getting that, like to your point of like feeling like you really had to think about walking, maybe didn't have quite as much of a filter, because you're getting that dissociative effect. We're separating mind and body. So yeah, we do definitely hear that, and a driver is a must at our clinic. No driving after ketamine at our clinic, and I think pretty standard everywhere. But usually, I tell people like it takes about 2 to 3 hours after your ketamine session for you to really start feeling mostly like yourself. And then by the next day, you feel back to 100%.
Yeah, I would feel like it wouldn't be a good idea to go to work or anything afterwards. Like if somebody had the ability to go and have their session and then do a lot of nothing the rest of the day, that would be the smartest, most ideal way to handle the medicine.
Yeah, I agree. I get that question a lot too of like, will I be able to work after this? What can I do? And it kind of depends on what you do for work. But I always recommend people just be gentle with themselves for the rest of the day. Spend some time in nature if you can, kind of avoid high stimulus situations. Take a nap if you feel like you need to. You might feel kind of sleepy. So just kind of like some gentleness with yourself, I think is really important. And I actually find that the people who are able to do that and commit that time do the best, rather
Yeah.
than the people who are like, hey, I'm going to do this, but I really got to send some emails when I get home. I got to get back to work and do a few things. I find that they're not giving themselves that recovery time, and they're also not giving themselves that like self integration time. You might integrate with your therapist later, but like you're not giving yourself the time to integrate. So
Mm-hmm.
you're really missing a key component of the whole process when you go back to work immediately. So yeah,
Yeah.
taking that time, that gentleness, super important.
What do people tell you the most that they feel in their physical body during the experience?
Yeah, I think the most common thing I hear is floating. Yeah, waves of the ocean feel like they're in space, floating on a river, things like that. I also hear numbness and tingly. And then sometimes I'll hear people say like, they feel like expansion and contraction, not in an uncomfortable way, but in a really gentle sort of way, like their body or their just being, maybe not even their body, just expanding and contracting.
Almost makes me think of like when you're breathing, that expansion and contraction with the breath, and then they're just more aware of
Yeah.
it in their body.
Yeah, yeah, and I think it's the sensation is just heightened too. So where it feels like you're taking a small breath, maybe here and now on the medicine, it feels like a huge breath when you're taking in all the air around you and then blowing out all the air into the
Hmm.
atmosphere. It can just be really accentuated by the medicine.
Yeah. Yeah. I would love to talk about the addictive aspect of ketamine
Mm,
because I do think that there can be addiction to ketamine, not so much in those therapeutic sessions when you're going in
yeah.
for, 6 sessions in a short amount of time. But
Mhm.
I would love for you to talk about that briefly.
Yeah. So we're definitely seeing ketamine addiction. Where we're seeing it is with street drugs. Not with, to your point, kind of like the controlled clinical setting, but still an issue to contend with. When we're talking about street ketamine, oftentimes people are getting that it's a powder. You don't know what's in it. You don't know if it's been cut with something. You just don't know what it is. I also think you have to think about set and setting when we're doing this in a medically and controlled environment. But if you're doing it in a party scene, there's no emphasis on set and setting. There's no one to help you, guide or control, the frequency of ketamine use.
For the
So yeah, we're
dosage, if you're
or the
doing powder.
dosage. Yeah,
Yeah,
for
because it's
sure.
weight.
Yeah.
It's ours was based on weight.
Yeah. Yep. Ours is too. That's kind of like our starting point at the clinic. We use weight-based dosing, and then sometimes we'll make tweaks beyond that. But that's kind of those put some guardrails in place, for dosing. You have no idea what you're getting or how much you're getting when you're using a street drug. And so yeah, we're definitely seeing ketamine being used and abused more frequently as a street drug.
Hmm. And then what about esketamine? Is that the nasal spray?
It is, yeah. Esketamine is a specific formulation of ketamine that actually has been FDA approved for mental health purposes. It's slightly different than like the ketamine that you had as an intramuscular injection, or the ketamine that we use at the clinic. That's probably like true and traditional ketamine. S-ketamine is a slightly different variation, and it had to be a slightly different variation to get the FDA approval, right? You
Hmm.
can't approve a different drug company can't take the same drug and then try and approve it for their purposes. So there had to be a slight tweak in the formulation. But yeah, S-ketamine is a type of intranasal ketamine. And there's a standard of practice that's specific to S-ketamine that's different than, what we do for IV ketamine. And I think with S-ketamine, varied results. I think some people get relief from S-ketamine from things like depression and anxiety, but far and away, it just seems like from the data, IV ketamine is just way more effective.
Yeah, you were saying with IV ketamine, you can kind of titrate the dosage throughout the entire experience versus
Yeah.
intramuscular, which might have a peak and a valley. Is that right?
hmm Yeah. So yeah, that's kind of like the beauty of IV ketamine is because you have an IV. We start an IV, so we put a little catheter in your vein, and then you get a slow, continuous infusion of ketamine directly into your bloodstream for 40 minutes. That's how we do it at the clinic. Versus like intramuscular, I'd actually give you if you came in and wanted to do intramuscular at our clinic, an intramuscular session and an IV session. I give you almost the same dose, either IV or IM, but you would have a very different experience because instead of getting a slow, continuous infusion of ketamine into your bloodstream like you do with IV, I would take that same full dose and give that to you potentially all at once in an intramuscular injection. So you get a really steep uptake of ketamine into your bloodstream. So that kind of translates to a really steep uptick in an intensity of the experience rather than kind of like a gradual incline and kind of like a plateau of experience and then a slow come down with IV.
So with IV, if somebody's not having experience, you can increase the dosage mid-session.
Yeah, if we needed to. If we need to, we can give just like a small bolus, just meaning like a really small amount of ketamine directly into the bloodstream. We can just push that and restart the infusion. And sometimes that's enough to get people kind of like over the hump into a deeper experience. Or if they're like, hey, this feels a little bit too intense, we can actually slow down the infusion. So instead of getting, you know, a certain amount of medicine over 40 minutes, we can give you that same amount of medicine over 60 minutes. So it feels ultimately less intense. So we can increase or decrease the intensity of the experience, so to speak, with IV. Yeah.
And then there's ketamine lozenges.
Yes.
What are
Yep.
those?
I know. There's so many different ways that you can do ketamine. So there's also like ketamine melts. So yeah, the lozenges. So they're little, they're kind of like little pills that melt under your tongue and get absorbed into your system that way. So, in in my experience, what I find with like the lozenges are it takes longer than intramuscular or IV to start feeling the effects of ketamine. And then I think the effects of ketamine actually last longer, where you kind of get that tail of ketamine, kind of like you were saying, like maybe at the restaurant where you still weren't quite feeling like yourself. I actually think that tail of ketamine is longer when you do the lozenges or troches that melt under your tongue. Oftentimes, people are doing a low dose of ketamine in the form of a troche and then doing talk therapy during their ketamine session. So they're not having the same depth of experience that you're getting with IV, but choosing to do a lower dose and maybe talking to their therapist during that time.
I could see that being really beneficial as a therapist
Yeah.
because it pulls your guard down, it
Yeah.
disassociates and pulls you outside of the experience. So instead of being in it, you're able to step outside of it without being flooded by emotion. So I feel like
Yep.
as you say that, as far as trauma is concerned, that might be a really interesting way to move through trauma.
Yeah, I think so. I just kind of think of it as kind of like softening your ego, just so that your ego defenses, you know?
Yeah.
And so traumas or emotions or things from the past can kind of come to the surface and not in a bad way, but in a way where you can work on healing those things or look at those traumas from the past through a different lens, through this lens of ketamine, you know? So it can help people just kind of like look at their traumas in a different way. And for some people, it can be really helpful to talk to someone during that experience. So for those people, I think, low dose troches, talking with their therapist, also another way to use ketamine.
So with other psychedelics like psilocybin mushrooms, like ayahuasca,
Mhm.
um, there sometimes is really deep buried unconscious material that comes to the surface where a trauma got buried when somebody was 5 or 10 years old. And then all of a
Yep.
sudden it appears in that psychedelic experience for the first time in 20 or 30 years. I'm
Yeah.
wondering if that happens in ketamine too.
It can. I think it can happen in any psychedelic experience. I would say when I think about all the different medicines, and there's so many medicines out there, but what I know about the different psychedelic medicines is I actually feel like ketamine can be a more gentle medicine than ayahuasca, bufo, psilocybin, those sorts of medicines. And so we can see traumas resurfacing, but it tends to um, be in a more gentle and curious way. Sometimes with psilocybin, ayahuasca, it can be like it comes to the surface and it's in your face.
Yeah.
And it can be really intense. I find that when I compare the medicines, ketamine just tends to be a little bit more gentle all around. Not that it can't take you; she can definitely take you for a wild ride, but just in comparison to the other medicines tends to be a little bit more gentle. So that stuff can
Yeah.
come to the surface, um, but yeah, not as overwhelming as the other medicines can be.
I'm also wondering with ketamine, is it sometimes such a jarring,
Yeah.
intense experience that it kind of kicks somebody out of some really deep depression and they're just sitting in there? Is it sometimes
hmm
like it shocks your system and it kind of knocks them out of it a little bit? Is that how it might work?
Yeah, it's the analogy that I like to use with depression, I think of it as like you're in a dark room and you're holding a flashlight. All you can see is right in front of you. You're surviving,
Hmm.
and ketamine comes in and turns on the light. And then all of a sudden you look around and you can be jarred because you look around and you're like, "Oh my gosh, I've got all these other options besides what was right in front of me."
Mm,
And so there can be that like shock to the system of like, "Oh, wow, things don't have to be as I perceived them to be. There's
hmm.
other options, there's other opportunities." So it can give like a little bit of that shock to the system, to your point, that jarring effect
Yeah.
to kind of move people forward. And again, I kind of think of it as like, hey, here's the end goal. Now let's build the skills.
Yeah, it seems like a reset button that gives you a window into other possibility,
Yes.
instead of being stuck in the loop that you might be stuck in.
Yeah. Yeah, I talk about ketamine a lot as like a pattern interrupt, because there's a lot going on when people have depression and anxiety. But if we were going to, just kind of like broadly generalize, we are creatures of pattern and habit.
Hmm.
And so just like how you bend down and tie your shoe, you don't think about it because it's muscle memory. The same things can happen with emotional patterns. And so where you get triggered and you react, that can kind of become a pattern. That's something that your brain knows how to do really well. So with ketamine, when we're going in and we're trying to create those new synapses, those new brain connections in the emotion center in your brain, I tell people if you get that trigger, instead of reacting, you can pause and you can respond. You can pause and you can have options. So you don't have to have that same reaction that you typically have. We're breaking that pattern and we're helping you to create new ones.
Hmm. Yeah. Yeah. What is one thing that you wish that people, when you talk about ketamine, would understand or know about it,
Mm.
or something that's
Oh,
super misunderstood around it?
yeah. Yeah. Um, One little like tidbit of advice that I like to tell people going into the experience, which is so simple, but um, I find just like so helpful for people is I always tell people, this experience will have a beginning, a middle, and it will always have an end. Because what I find is it's really interesting to me. Inexperienced people coming in say things to me like, "I'm worried that I'll never be the same, or that I won't come back to this body, to this earth, that I'll be changed in a way that's negative, that I'll never come back." And it's really interesting. I always tell people you will come back to this body and you will come back to this mind, but we're creating those new synapses. So hopefully we're giving you just like a little bit of an upgrade as we're doing this.
Hmm.
But I wish people would know this is actually like in a medically controlled setting. This is super safe. and actually really positively impactful. And to just like take that leap, even though it can feel a little bit scary, could change the trajectory of your life forever.
Yeah. And I think that's important to note, to go to a clinic and or do this under supervision of a mental
Yeah.
health professional or a medical professional, because you never know what's in street drugs. You don't know the
Yeah.
quantities. It is weight based. It's really important that you're getting good quality things, and setting intention. All of that is so important, and to have support
Mhm.
during any psychedelic experience. It can be dangerous to go through something like that and not have support if you don't have a strong foundation.
Absolutely. Yeah. Yeah. Having a medical provider go through your health history, just making sure you're physically healthy enough for ketamine, and also evaluating to make sure you're mentally healthy enough for ketamine, so you can maximize the experience. Super, super, super important. I can't emphasize that enough. So,
Yeah,
yeah.
awesome. Well, Andrea, how can people connect with you? Where can they find you? Tell us about your clinic.
Yeah, yeah. So we are an IV infusion ketamine clinic. That's the gold standard of care for ketamine. There's a lot of different ways to do it, but this is the way that we find to be the best and most effective. So people can find us online at thewellbeingcompany.com. And can also connect with us through by email, by phone, and yeah, there's more information on our website about the services that we offer, and more things coming soon.
Awesome. And I'll drop all those links in the show notes if people want to connect. But yeah, I want to thank you so much. I've been wanting to have somebody on
Yeah,
about ketamine for a long time, and I'm super excited to have had this chat with you today. So thank you so much.
yeah. Thank you, Nikki. This was fun. So
Yeah.
thanks for having me.
Thank you for listening to the Connected Community Podcast. If you enjoyed today's episode, please like, share, and subscribe. I can be found at www.nickyyoga.com, NICKYYYOGA.com. Until I see you again next week, I hope you have a beautiful day.